I'm so happy to learn that preventive oncology is gaining a new momentum in the state. Thanks to all of you. When Dr. M.V. Pilla, sir, told me about this, I was so eager to know about this program, and I promised that I'll be here. Thank you for the invitation. This preventive oncology, or the cancer care, prevention of cancer, is one of the prime focuses of Government of Kerala, the health department. As you all know, or many of you know, we have a special mission dedicated to the health department. And that mission is called Ardram in Malayalam. In our mother tongue, Ardram means tenderness, tenderness of the heart, which implies that, or which means something like holding closer. So during this term of the government, we are implementing Ardram 2.0, and we have set 10 goals. Definitely infrastructure development is one among them. Connecting all the labs in the government sector is the second one. We have achieved that through the hub and spoke model. All 1,200 labs are connected together, connected in a network, in an hub and spoke model. Then we have the lifestyle, addressing the challenges of the lifestyle diseases. Another one is starting annual health checkups. And the next one is cancer prevention, which again is related to prevention of lifestyle diseases. So prevention of cancer, again, another one is a One Health program, disease elimination, integrated research, and so on. So in the last 4.5 years especially, we dedicated our time and we have invested more in this cancer care, cancer prevention. We started a cancer data registry for the first time in the state. Cancer data registry, as we all know, helps us in tracking the trends, understanding the disparities, to evaluate the programs, to strengthen the research, and to organize small control programs at the population level. And then what we did was that we developed the cancer grid, then cancer suite. We decentralized the cancer treatment. We earlier had the regional cancer center at Thiruvananthapuram, Malabar Cancer Center in the northern part of Kerala, Talasheri. Now we are going, Honorable Chief Minister is going to integrate the Cochin Cancer Center at Ernakulam. And during these years, these institutes, RCC and MCC, they are doing wonderful research. RCC has developed, Dr. Rajanish was here, I think. RCC has developed SurveyScan. And for SurveyScan, RCC was awarded by WHO, RCC in collaboration with the CDAC. Malabar Cancer Center is also conducting many researches. We have opened an innovative hub there, and we are integrating modern medicine with Ayurveda for palliative care especially. And last year, 2025, on February 4th, on World Cancer Day, we started a campaign which is called Arogyam Anandam Agatam Arbudam, which means that health is joy, let's prevent cancer. Honorable CM inaugurated the campaign, and in a period of 10 months, 21 lakh people got screened in Kerala. The first month, 15 lakh women got screened. So it was not a simple task, because we were continuously doing the easy activities. We were doing the awareness program and all, but people were not getting motivated. People are really afraid of going to the screening. So what we did is that, so we thought that it will be easier to bring these people or our people to the nearest health center rather than going to the cancer centers. So in the last 3 years, we started another thing which is called the lifestyle, which is for assessing the burden of lifestyle diseases through an app which is called the Shaili app. Shaili means it's related to lifestyle. So we have the field level health workers, they are called Ashas. They were trained, the JPHNs were trained, the JHIs were trained. And through this Shaili app, they visited every house. And they analyzed, they collected data. And that data, we ensured that this data will be stored in the state data center. Only that person, and through that person, the doctor or the healthcare worker can access the data. No one else can access the data. For sure, the department can analyze the data, like how many new hypertension cases are there, how many new diabetes cases are there. So what we try to do is that, after conducting these surveys, we have trained these health workers to analyze the risk factors. So we gave a score in the scientific way, and we asked the people to come to the nearest health center, to meet the doctor, the family health center. We call the health center as a family health center, which means that the health center is for the entire family. We have a lab there. And I told you, we have developed the cancer grid. So we encourage the people to come to visit the nearest family health center. So the doctor will see the person, and the doctor will see what is the physical status, the health status of the person. So that was going on, and it's still going on. Honorable CM has inaugurated the third version on January 1st. So this was a continuation. What we did is that in 2023, we started what is called the Janagi Arogya Kendra, which is called People Health Center. So in a ward in Kerala, we do have families between 400 to 500 families are there. So for 3 to 4 wards, we started People Health Centers, and we posted 3 health workers there, the multi-level service provider, the JPHN, the JHI, and of course the Ashas for the 3 wards will be there. And we did give training to these health workers to do the preliminary cancer screening for finding out the lumps, and also even for the preliminary screening for cervical cancer. So people felt more free to visit the nearest health centers, the people health centers. In these health centers, the people's health centers, in Malayalam it's called the Janagi Arogya Kendra, we have started People's Club. Every Tuesdays for women. In Malayalam, we call it as a Stree clinic. So any woman can walk in, and she can do the test for hypertension, for diabetes, for anemia, for checking the, for other blood tests also can be done. So we have also started health clubs there. So what I am trying to say is that it was easier for us to encourage the people to come to the health centers, the people health centers, which is nearest their house, and do the preliminary screening. And of course, I think it was a collective effort. Dr. Pilla was there with us throughout this campaign, and all the private sector, and for the first time in the history of the state, the private sector supported us or cooperated with us, and which indeed opened a new era in the prevention of cancer in Kerala. So in the first month, 15 lakh women were screened, and now it's 21 lakh. And now what is happening, we do have the NCD clinics in health centers every week. We do have 2 days dedicated for this non-communicable diseases clinic. And when we visit or when we go to the doctor in the health center, on these days, we can do the cancer screening also. More than 600 new cases were identified. And I think now this new year, we have stepped into a wellness mission also. So to prevent lifestyle diseases. And also, I mean, we have decentralized not only cancer treatment, we have decentralized the cardiological treatment too. In every district, we do have cath labs. So what is the result? Ultimate result is that when we, after starting the cath labs, earlier it was 30%, the mortality was 30% because of this cardiac arrest, and now it has got reduced to 6%. That is the difference. So I'm concluding my words. Thank you very much. I don't know how to thank you, because eminent persons like Dr. Pradipan his colleagues, her colleagues in the Mayo Clinic, and all other eminent dignitaries here. Yeah, I thank all of you for coming here, for finding time to come here. So on behalf of the Health Department, on behalf of Government of Kerala, I would like to express our sincere thanks to all of you. And once again, to the entire team, thank you very much. Mrs. Ampli was calling me yesterday, this morning also we talked. So every person who is involved in this Swasti Foundation and this project is so committed and so dedicated, which indeed encourages us to do more. And definitely, I think that the suggestions or the ideas or whatever is coming out of this conference will definitely help us in framing policies, strengthen our policies, and strengthen our activities. Thank you very much.